Hello, everyone. Thank you for joining me today. If you're hearing this broadcast, if you can send a thumbs up or put a comment as to where you're joining from and what time it is. Today, look, I'm going to be covering a little bit about what I call functional dentistry and a lot of the questions that people ask about their own dental health, the dental health of their families, and how they should go about approaching certain conditions that they experience, and what the philosophy really is behind functional dentistry and behind healing ourselves and understanding how the mouth really connects to the entire body. For those that aren't so familiar with my work, so my name's Dr. Stephen Lin. I'm a trained practicing dentist from Australia. I have a background in biomedical science, and my story in dentistry has largely been a part of, I think, my mindset that I want to understand, everything about, my own body. I have a sports background, so when I was younger, I played competitive sport, and I was tuned into early as to how to think about, what we can do to make our bodies perform better. But in my undergraduate, I went on to study biomedical science, and that tuned me into kind of the really deep processes and underlying working factors that are going on in our physiology. And then I went on to study dentistry. Now, going into dentistry, I had this thought, that I would, dentistry seemed very practical to me. I'm a solution-based person as well, which dentistry is very much focused on. Dentists, so some of the best health professionals you'll encounter in terms of getting a solution to a problem, and that really is something that it's a difficult part of dental practice. And so I like that aspect of it, that there was a solution based philosophy, but I also thought that I had a belief within me that the mouth was far more important to the body than what, perhaps we were thinking. And, maybe I hadn't even thought about it then, but that was leading me, I think, to, helping people understand how their teeth, how the mouth connects to, everything that's happening throughout the body. And so when I went into dental school, dental school is a really challenging thing for a healthcare practitioner to go through, because you're basically, I'll go into this a little bit more later, because what we're trying to do here is to frame the problem point as to why oral health in society isn't as perhaps isn't perceived as or understood as well as what we could or what we like. Hi there, yes, we've got Noelle tuning in from the UK. And we have a few questions also in the comments too here. I'm not sure if you can see them, but if you have questions, please leave them in the comments and then I'll address them at the end. But we'll have a bit of a discussion first, because I just wanted to lead people through a little bit of the philosophy of the mouth-body connection, functional dentistry, and how dental disease, in my opinion, really does open up a whole new understanding of human physiology as a whole. So the problem point in dentistry itself is that we're dealing with, some of the most common chronic diseases in the world. Childhood tooth decay in the Western world, up to 50% of kids by the time they're 6 will experience decay. Up to 90% of people will experience some form of gum disease in their life, and this is both the mild forms and then later on the severe forms. Crooked teeth or malocclusion, which is treated with orthodontic braces, is a climbing issue in society. And now the numbers are a little unclear. There's, saying upward of 75% of kids need orthodontic work. That's a big health issue. So it's one of the most common things between those three things. And actually, if you add wisdom teeth extractions, which is one of the most common surgeries, elective surgeries, then you don't experience many people in society today that don't have an experience with dental disease themselves. And so what we're seeing is that this huge issue in society is being, uh, trying to be quelled by the dental profession. So the dental profession is designed to try and help society with these problems. And I think a big part of that is, and a big part of, perhaps why we're not winning that battle, because these numbers are going up, is that perhaps we're not understanding the full picture. And this is where I really think functional dentistry starts to come to the forefront, because the problems that we're fixing, the dentists are fixing in society, need to be fixed. There's no questions about that. We're here. The reason why you're listening to me and why I'm talking about this stuff is because we're trying to solve a bigger problem here. We're trying to get our heads out of just the problem, reaction, solution mindset, and how can we get in front of these things? Can we prevent these issues in our kids? And so, look, I had this kind of mindset going into dental school, but I've got to admit, when you're doing healthcare training, medical, dentists and practitioners, medical practitioners spend some time studying together. Then you're really time poor, so you don't get a lot of leeway to think about what the things you're learning fit into a broader size societal context. The courses try to introduce this stuff, but you're busy, and tutors are busy, lecturers are busy. People don't have a lot of space to be thinking about this stuff. And so going through dental training, I have to admit, I didn't think a lot about what the real impact, dentists on society were having. I think that's a bit of an issue, because if you think about it, dentists are dealing with some of the most poignant issues in our society today that are plaguing the world, and we need to be thinking about how and why this is happening. And so that's what we're really trying to delve into here. And my thinking on this, for those that haven't heard the background of my work, actually, I took some time away from dentistry after I graduated. I went, I'd practiced for a few years, and I became a little bit disillusioned, thinking, can I do this for the rest of my life? A lot of questions were popping up for me that I thought that that my textbooks weren't answering. So I took some time off, and I actually was in. I spent some time in Europe, and I was in a travelers hostel in Turkey, in Istanbul, and I came across a book called Nutrition and Physical Degeneration by the Dr. Weston A. Price. And Weston A. Price was a dentist who lived in the 30s. I'll do a detailed show on the Weston A. Price whole philosophy and his work, because it's a fascinating connection to how we are, how we've missed this broader societal conversation as to how important dental health is. But so I picked up this book, and I'd never heard of this guy before. I'd just done 7 years of tertiary training, and it was never referenced or never discussed. And so my immediate reaction was to dismiss this book, because I thought, it must have been disproven between the time it was printed. It's full of black and white pictures and so forth. So we really do have this inbuilt program to kind of dismiss things that aren't on our beaten narrative, on things that are commonly taught in tertiary education centers, universities, and so forth. So that was within me, and I put the book in my bag and actually didn't look at it for some time. And then I was kind of, now that I look back at it, I was following a little bit of a calling, but so it was kind of tugging at me, and I went back to the book a few years later, and I looked at it again, and I found that the writing that Price had put together really was much broader than what I'd initially thought. He had 15,000 photographs of 12 different cultures, and a theory that food was driving the disease he was seeing back in his clinic in Cleveland, Ohio. And like, this is a huge undertaking. You think about a dentist in the 20s and 30s sailing around the world and writing and recording and taking photographs, even, just taking photographs and recording them is a huge undertaking. So I began to appreciate how much of an effort and really what this Nutrition and Physical Degeneration is an easy book to read in terms of medical texts. So he writes it for the lay person. But you have to interpret a lot because he's bringing a lot together. And so this was kind of, something cracked in my head, and I began to see things in a different manner. And I began to see that, hang on, Weston A. Price was bringing up things that I didn't understand. A trained dentist in the modern world who had, biomedical science background, and there are things that I haven't even been introduced to. So this kind of introduced me to the idea that teeth hold the oldest human stories that our physiology holds, but also that our cultures hold as well. And that's what Price did. So Price went around the world. He looked at ancient cultures and how the modern diet was interfacing in these people that had been living on this diet for thousands of years. And it's a fascinating book if you haven't read it. I think I'll dedicate an entire video to this to really kind of dig into the details. But I just want to give you a little bit of an overview. But so what Price was doing is showing how, teeth actually give us a deep human message about what our health is telling us about. Because what he showed was that when people ate the modern diet, their teeth immediately in one generation began to degenerate. He saw rates of tooth decay rise up to 90%. And he also talked about the crooked dental arch and how previously eating traditional diets, including the anthropological records in each of the places, that he would find that there was a perfectly straight dental arch, that wisdom teeth fit. So, today we're not told the cause of wisdom tooth impaction, but he was saying that, once we start to eat this modern diet, our jaws don't grow as much and then the teeth don't fit. So that's broadly what he was saying. And this was an area that really is only just starting to bubble up now, in the realms of craniofacial medicine, and how the craniofacial system develops and affects the dental arch. So we really have missed a perception as to why a lot of these problems were happening. And that was what the core message that I took away from Price is that, we have to be thinking about why. Why would a child's tooth decay? Why would one child's dental arch be crooked and another's not be crooked? These are questions that I think as a society we really need to be asking. And I think, if you look at the current health messages that we're seeing, there's a lot of things that we need to really get set on, because when we don't have our health right, we really, as a society, don't have a lot. And as a human being, your health is your central pivot point of everything you do in your life. You can't be successful, you can't be happy and spend time with your family unless you're healthy. So we're talking about a fundamental aspect of the human state. And so Price was tapping into, and he really opened up my eyes. I started to read dental anthropology books, and there's a lot of literature on this stuff that it's very, very quickly mentioned in dental school today, but I don't think dental or medical practitioners get enough education on what anthropological records are showing us, and what the human health record really is. And so when you look at the anthropological record, the dental diseases, the rates that we talked about at the start of the video, only pop up in the very, very near past, and that we're talking about in a couple of generations. And so when you start to put this on a perspective of jaw and mandible bones and teeth, now the teeth and bones are what survive in the fossil records. So that's what our anthropologists, for the most part, what they draw our they draw our data points from on to understand what our human ancestors did. Really, really important, right? So dentistry then becomes this central pivot point around what we know about our past. And this is an area that I think is absolutely fascinating, and that I've only been drawn into more and more since looking at the mouth in this way. And so it gives us this cultural aspect, and it gives us this anthropological aspect, but it also gives a deep, deep underpinning of the physiology. And I see in question, there's a question in the comments here about bleeding gums. And so when we look at the cause of bleeding gums and the pathophysiology of it, well, we get a very detailed explanation. And I'm going to go into that a little bit more. But overall, what we're seeing is that there's inflammation in the body. And Price, back in the 30s, was saying, well, people that have dental diseases, they kind of seem to have other problems too. And he talked about other conditions then. Now, a lot of the conditions that people suffer today, Price didn't see, and they didn't exist back then. But since then, since the 50s, since the 60s, and we now know that this is connected to how we changed our modern diet. And I think we'll probably dedicate an entire video on this just so people understand the underpinnings a little bit. There are a lot of dietary recommendations that have fueled disease. And just from a dental point of view, we know that the misunderstanding of the effect of added sugars in foods has driven the tooth decay epidemic that we're currently seeing in kids. And, we're seeing a spike in this in the modern day society. And so we're still not a hold of this problem that Price was talking about, nearly 100 years ago. And so he pinpointed 3 factors in the modern diet that we were putting in that traditional cultures didn't, and that was sugar, vegetable oils, and refined flour. Now, those 3 factors make up a huge proportion of what you see in supermarket shelves today. So as a consumer, you need to understand that a lot of the foods that are packaged on food shelves today isn't what we used to eat a long time ago, and it has an effect on your body. Bleeding gums is the first manifestation potentially of inflammation in the body. But so as a whole, this is starting to, you can feel that we're starting to broaden our understanding of the human form. And then there's these 3 aspects of both culture, anthropology, and physiology that dental health really begins to open our minds to. But if we look into how society, how we perceive dental health, it really isn't like this at all. The dental and medical profession is very separated, and I can attest to that it's very difficult as a practicing dentist to have a meaningful conversation with a doctor. And that's not because out of any criticism to dentists or doctors. It's actually because the system isn't set up in that way. You just don't get time. Patients really, it's very, very hard for a patient to get communication between a doctor and dentist because you're in different offices. You have different time schedules. Sending communication between is hard. And unless you're in a hospital setting where, or a clinic where all the practitioners are working together, that is very difficult, and it highlights a real problem in our society that we've segmented dental health away from other healthcare professions. And this may be, or is, to the detriment of understanding why oral disease underpins many of the issues that are connecting to the systemic problems we're having. Now, the literature shows us, and they teach dentists this. You have classes on the oral systemic connection, the literature that shows the connection between gum disease and cardiovascular disease and chronic obstructive pulmonary disorders and preterm birth in expecting women. And there's a whole connection to type 2 diabetes. Now, type 2 diabetes is a great example because it is one of the more prevalent chronic diseases in society. It's rising. We now know that it's connected to sugar. And so when you increase your intake of dietary carbohydrates, you increase your blood sugars, and this can fuel insulin-resistant type 2 diabetes, which is the connection there is that. So, for instance, when I see a patient and I see uncontrolled gingivitis that some people are asking about in the comments, and I don't see a good explanation in terms of their oral hygiene, because you have to remember that for the most part, our messaging, the behind the cause of gum disease has been, well, you need to clean your teeth better. And that's a factor. We'll talk a little bit about that too. This is the biome connection to the gut, and that there's bacteria living within your mouth that have protective factors. But when I see a patient that has, especially someone in their maybe late 20s, early to mid 30s, that have uncontrolled bleeding of the gums, maybe their gum disease has gone a bit further than what we'd expect at this stage, and we say that age is a risk factor for gum disease, then my mind is thinking to, well, have you had your blood sugar checked recently? And especially if they're a regular attendee of the dentist, because a lot of the time you'll go to your dentist for cleans and then your gums just don't get better. Well, that's a systemic issue fueling the problem that the dentist is seeing in the mouth. And it's a prime example of where, if we had a medical system that had better discussion between practitioners and a better system to say, well, we're picking up this in the mouth, how it would be great if you could test this and see, what are the blood sugar levels, and are we in the realms of pre-diabetes? Because pre-diabetes is a huge risk factor for gum disease, and when we start to underpin this, is we see these comorbidities with gum disease, heart attacks and strokes and so forth. We're talking about things that are potentially very, very important for preventing a serious chronic illness. And chronic illness in itself is a long-term process. And we really need to, we're driven in our mindsets in how we treat health issues today, is that there's a fix and there's a medicine and there's a I'll go and get a surgery. But for bleeding gums, for instance, the real message there is that we pick up the signs early. If you floss your teeth daily and you see bleeding gums, you really need to work to try to see if you can overcome that. And the first step is to somewhat understanding where that is coming from. Think about your food, your stress, your sleep. All of those things begin to underpin, why those bleeding gums happen in the first place, and they're going to underpin why the gingivitis will progress to gum disease and potentially put you at risk of other comorbidities. So there's a really simple connection that I've found, looking at the mouth in this way and, learning about what other health practitioners are doing. And so a lot of my time in the last few years has been talking to other practitioners, visiting other practitioners, and seeing what they do. And I really think, that dentistry is teaching us that we have to get our healthcare system together, and healthcare practitioners talking to each other and telling them about what they're seeing, and working off each other and working with each other. And a lot of especially dentists that are doing great work in pushing forward how we understand the oral systemic connection, work with other healthcare practitioners. They do what they do in the chair, and then they refer and they ask questions from experts in other areas. And this is just something I feel is invaluable for a patient. And one of the biggest recommendations I can give to anyone is that you go and get a second opinion, regardless of who it is, and also look outside the specialities that you're talking to. When you go to a medical or dental specialty, you're talking to a very, very qualified person. And that qualified person, they have to pin their work on success. So they will find a pattern and a program and a system that works for them. They'll base it on all of the skills they've acquired. But it is a pattern, and today we're seeing that a lot of these chronic diseases, not one size fits all. So you as the individual really need to think whether that's for you, get a second opinion on these things, and get from outside the professions that you're traditionally seeing. But if you go into dental school itself is a good example as to how healthcare is very designed to fix diseases, and it's a good way to kind of just to understand where dentists are coming from, because dentists are really highly skilled people. They're from everything that I've most part that I've experienced is that they're caring and nice people, and they want to help. And they've got a tool set. That they've learnt and that they've invested a lot into, and that they want to try and help their patients. It's very difficult too. You have to understand that dentistry is a very, very difficult profession, and we're working in jaws that put a couple of 100 pounds of pressure down on teeth, and we're trying to rebuild things and trying to rebalance things that within a wet environment. It's a very difficult thing. It's stressful. You never want anything to fail. Things do fail. And so there is a lot of stress on the dental profession, and I really think that one of the things that comes up a lot is that dentists are brought up a lot in terms of high suicide rates amongst all professional professions. I'm not sure if that data is. I've tried to look into whether that's the actual studies that show that, but it comes up a lot, and there is data showing that there is a high suicide rate in dentistry. And I think that's a sad indictment of these people are very, very skilled, and I think it's a broader reflection that maybe we're not understanding this whole thing. Maybe the system we'd set up for these people to learn and go in and practice in and help people with a problem that is really important isn't quite right for some reason. Anyway, so that's just a little kind of background on that. But dentists are, they're trained in dental school. You learn how to restore teeth. You learn how to take teeth out, which is oral medicine. You learn periodontics, which is the gum. So specializing in restoring the gums and treating gum disease, and orthodontics, which is straightening teeth and putting and addressing crooked teeth. But if you look at those modalities, and this is what after you split up from your medical colleagues in school, that's what you basically go and learn. You go and kind of tinker with models, and you go and you start to see patients. But all of those things you're doing are you're basically learning to fix oral disease. And a lot of the early parts of your career is learning how to efficiently do this and finding the systems that work for you. Every dentist does things differently. Every healthcare practitioner does things differently. And it's an interesting kind of thought that came up. I think I was talking to one of my colleagues, and the amount of tools or techniques that a single practitioner will employ is probably in the realms of maybe 10% at the most. So when you sit in a single practitioner's seat, you're at best getting 10% of the realms of possibilities. And I think that's a really important thing to understand, is that no practitioner can do everything, and that you really are going to add a lot to your the potential outcomes, but also the approaches that we now have. There are so many technological approaches. I practice in Australia, and the things I hear about, I spoke to a German dentist a few weeks ago, which I'll be posting soon, and the things they do, it's like another age. Like I'm talking in the future, ceramic immediate implants. I'm not an implant guy. It's just remarkable what some countries will implement, and yet other countries are very conservative on. It's just good to know these things, because you can potentially go and find these things elsewhere. But so where I kind of went out and started to talk to medical practitioners looking at conditions like type 2 diabetes, like sleep apnea, for instance. Sleep apnea is a huge connection to the oral systemic connection. We're going to be talking about that a lot. If you've been following my posts, you'll see the literature that connects sleep apnea, snoring, to heart attacks, to blood pressure issues, to stroke, to Alzheimer's, dementia. And bad sleep is one of the more common things I see in the dental practice. And so these things really need to, we need to understand that sleep is critically diagnosed, firstly in the mouth, that we understand if the airway isn't working right, if the craniofacial system isn't as developed as it could be, as our ancestors were, then we're potentially at risk. All of this is coming together to show both the modern scientific view that, well, these people, this huge amount of people that experience, nearly 1 billion people experience are diagnosed with sleep apnea in the world, they are at risk of, a plethora of other conditions. So what an expanded view. So when we have practitioners that can, fix these oral diseases, can we understand them better? And I think that, so functional dentistry really has some arms so when I see a patient, I'm thinking in, a very small subset of categories of things that are potentially going wrong, because it's often I find that that's the case. Or, when we're referring to other practitioners and so forth, I want to find out about this. And the first thing is nutrients, because if we go back to where it all started with Price, his whole philosophy was that dental disease is caused by a lack of nutrients. And so when I see problems in the mouth and I see problems that they're concurrently talking about in the body, I'm thinking, well, there's not enough of the nutrients here. And these are the fat soluble vitamins. And we'll go into these in detail, but for the most part, we are lacking the fat soluble vitamins and their support nutrients in our modern diet. And that has flowed on to skeletal issues like osteoporosis. In the early 1900s, it was rickets and developmental issues of the skeletal system in children. When you replace vitamin D and A, they did this with cod liver oil, you can remove the rickets, because vitamin D affects the development of the bones as well. And we should be thinking of this in the craniofacial system as well. And so when we start to see patients with dental issues, we have to be thinking nutrients. And the other arms of functional dentistry that I see are growth and development. So how this adult grow and develop, and how does it affect their current state? And so how the jaw grew. If we have a high narrow palate, if the mandible is back, if we have an impacted wisdom tooth, well, it's a growth and development issue. How is this affecting them now? In kids, we're thinking, how can we intervene in this potentially? How can we prevent braces potentially? If we change the diet, if we change the breathing, if we change the sleep, can we impact the growth and development? Can we prevent braces? And there is a big arm of functional dentistry now doing this, and I think it's one of the more important things we need to be talking about in society, because craniofacial growth and development in kids can potentially prevent a host of conditions later on. And one of the big conditions that we talked about is sleep apnea. So the other arm of functional dentistry I find that we always come back to is sleep. How the jaw, teeth, and teeth grinding, and how this whole system is affecting the rest that people get at night. And we know all the literature is pouring out on how important sleep is, what the brain is doing during sleep. It's incredibly, incredibly important. And this is a often people that have bad sleep, they'll try a lot of different things, but the mouth is very, very much a great diagnostic tool to whether you're sleeping well. And then the last two prongs of functional dentistry that I find is the gut and gums. So the inflammation profile that we're talking about. If you've got inflamed gums, we need to be thinking about concurrent gut issues, Crohn's disease, ulcerative colitis, these issues. If you saw my post this morning, there's a paper showing how the balance between the biome begins to tip towards inflammatory, and then you get the breakdown of the gut lining. Well, the same thing happens in the gums. You get a balance of inflammation tipping towards bleeding gums, and this travels along to gums. Is a breakdown of the collagenous tissue that holds the gum to the tooth, and then the bone that goes with it. And so if we see it like that, if we see that the gut on the other side of that, where 80% of the immune system, and gum disease is run by the immune system, then we begin to understand that, well, this is a whole system we need to fix. And then lastly is biologically sound treatment. There are techniques that in the dental industry that potentially have been a little bit outdated. So we now have a lot of biological options for people, and that's one that I think that has mostly taken up this conversation of holistic biological dentistry. And so what I'm talking about is uh, certain metals in the mouth, for instance, can be replaced with ceramics or composite fillings, which all have, every treatment has its downside, by the way, and there's no, you, I'm not saying that you necessarily need to get everything removed from your mouth, but there are potential downsides. And if something isn't working, you may need to think about there are other options out there. So we need to take this view of biological replacement, because if there's an issue with, we now have the technology too. There's some interesting studies coming out, potentially on downsides of metals in the mouth. That's all a part of it. It's only a small part, but it's important that we start reconstructing there with biologically sound treatments. And so we're now starting to see that, that I hope you're beginning to kind of feel that, we're really just starting to unearth the real story here, is that, like there's so much to learn about human physiology based on our dental conditions. And look, just to finish off, I'll go through a couple of the questions because it's important that the community here really is, a big problem-solving community where we talk to each other and we talk about, problems that people are having. And I think that really helps. If people finding others in similar situations can certainly find a lot of valuable information. So I really encourage that. So let's have a look. Okay, so I have 3 of my root canal drilled teeth at the gum shows. I'm not buoyant to visit the dentist. Is there any other ways to treat it, doctor? So look, there's no other ways to treat it. No, you have to go and see the dentist. But dental fear is a real thing. So this is really important that, that we address this. It shows exactly, how in society that people are scared of going to the dentist, and, it's expensive and it's painful. And, I really think it's important that people in these situations understand that, you need to get this sought to. It's time to start thinking about and talking to, people that about, maybe local dentists, maybe going to talk to the office, talk to the staff, see if you get the right feel about things, but you need to get these things sought to. What should I do about my root canals? I have had one in each of my canines and have heard some biological dentists say you should have them removed and an implant put in. Would that be the best scenario, or should I just leave them in? Well, root canals, in my experience, they're a little bit of a gray solution. So if you've listened to the whole talk, I hope you've kind of got the scenario that, well, there's a lot of unideal scenarios happening in our mouth at the moment, and root canals is that it's an unideal solution to an unideal situation. But I've seen that many root canals, work fine, and for the most part they do. And it's really about patient selection. I do some root canals because I think that the only option is to remove them and put implants. That's not always available or practical for everyone. Some people don't have the best experience with implants. We have to really kind of look at both sides of the equation here. Some root canals just don't work. It's roughly, literature says 15 to 20%. And I think a lot of the issues that people have with the root canals is based on the 15 to 20%. So, whilst they're not ideal, and yes, so there's a dentist that says in Germany, who's very big on ceramic implants, he says they should be all replaced with ceramic implants. And that to me makes a lot of sense. It's really difficult to find practitioners doing this, and you may not be able to afford it. So look, if there are signs of infection, I would definitely think about either seeing an endodontist or having the teeth removed. Okay, so there's lots of questions here about root canals, but okay. Can you please comment about flossing breaking the gum barrier, opening a gateway to bad bacteria? So I think what Stephanie Leong here is talking about is if when you're flossing, you break the seal of the collagenous seal of the ligament when flossing. There is a communication there between, but you're not going to open a gateway. There's not bad bacteria as such, because you have to remember that the oral biome is in constant communication. You can damage the periodontal structures, the gum structures, but I wouldn't be worried. When you're flossing, you should be hopefully trying to access that 30% of plaque that gets between teeth, and remove that. And you if there's inflamed tissue there, you might see it bleeds, and that's okay. So I tell my patients that's okay if it's bleeding, that you're getting to the right places. You want to get that inflammation out. So there's a little kind of oral hygiene question there. Look, but so overall, dentistry in itself is, it's an evolving space, and so people, today have a lot more tips and a lot more things at their disposal, that people 10, 20, 30 years didn't have. So I think as a whole, we really need to think about, well, oral disease is a critically important aspect of my health. I know that that there are practitioners out there that understand this, and maybe it's a part of my entire healing journey. And so that's the road that I hope that we're all going on. That the reason why I share all this information is to help people kind of bring this together, because for me, as a practicing dentist, that's been my experience. I've found that looking at people's mouths has brought all of these things together, and I understand the body in a way. These things I've implemented into my own life, into my children's lives, that I think that hopefully the next generation can take into account. And so I'm going to thank everyone for joining me today. If you have any other questions, please leave them in the comments and I'll get to them. But we're going to be doing a weekly live video. And so what I'll be doing is posting the comment. If you have any topics you would like to hear, please leave them in the comments, and I'll be seeing you soon. Thank you everyone for joining me.